welcome to Better Health Together. You'll see I have with me the Commissioner for Mental Health, Tim Marney. Thank you so much for being willing to have a conversation about this important topic.
Thanks, as always.
And I have to say, even this week's media has been one to watch around mental health. We see a lot of mental health concerns raised by consumers, families, carers, suicide rates and so forth. And so we do collaborate together to work the best we can on the system, so to speak. But I wonder what your thoughts are about how we integrate better, how we join it up.
Well, I think we start with planning. So, as you know, from day one, from WAPHA, we've been on board with you in doing the planning work. In fact, I think we even sent staff over to sit with your staff to do planning in the first fortnight of WAPHA.
Yes, that's correct.
So that's the foundation that we start from in terms of integration. If we can do everything together, then hopefully we can have a system that is responsive in its pathways to the needs of individuals and the specific needs of each person. I think the peculiarity around mental health is it's a very, very complex condition with complex causal factors and complex treatment and care. As a result, the system is complex. So I guess in working with you, what we share as a goal is to make sure the system is integrated in terms of care and treatment, and make sure that clinicians, support service providers, whether it's mental health or AOD services, have the support as well to help navigate stepped care for consumers and carers.
And I think you're right, but sometimes we forget in the planning of services and the system that for the individual wanting to or needing to enter a support service or general practice or another clinical system, they are often in quite distress. You know, they feel the stigma themselves of what's going on in their lives. So there's much to be done, even trying to make that much easier for people to find the care they need.
And, you know, your My Community Directory is a start to that. And again, the Commission is working on something similar, but we don't want to add another bit of complexity to the system. So we're trying to work with you, or we are working with your people to make sure it's a one kind of entry. So that if someone is in distress, whether it be the consumer or their carer or family, because that distress is shared, that we have simple entry points to the system and also simple guides for clinicians as well.
And so if you were able to describe your aspiration for the mental health system as we understand it, system's a big word, what would that be?
A system that has very well integrated stepped care, and at every point when someone transitions to a step, that they are warmly transitioned to that step, not dropped into the system to find the next step. That's really, I think, my main goal, and underpins a lot of work we do around Atlas.
That's right.
Around mapping exactly what we've got, so that we can figure out, well, what are the gaps in the system that people fall into, and how can we jointly address those gaps.
Thank you very much for those words, Tim, and you will hear from us both, it is complex, it is tricky. That's not to say that best endeavours aren't made either, and I know we've done some great work together building the sort of nest by which we can integrate through planning and commissioning and so forth. So thank you very much.
Thank you.
See you next time. Bye for now.